I'm from Everett, Snohomish County, and I was going through an apprenticeship. I think it was my 4th year. Everything was going good, and then I ended up getting hurt at work, and I broke my neck. Me and my wife started having problems, and we ended up going through a divorce. It was a tough one. Pretty much lost everything I ever worked for. I ended up homeless. Ended up in a tent. I was so ashamed. As a man, I got to work. I've always been able to work, go to a temp service or do whatever. I've been homeless now for 12 years. It's like I haven't seen my kids now in, about 5 years. Because I don't want to bring them to a tent and say, yeah, this is where Dad lives, They remember me when I had it all. It just got real hard. I ended up having a heart attack. And then Harborview took me in. And I had a team of doctors, they were just awesome. They pulled for me.
Harborview Medical Center is a really amazing place. We can do a lot of great things. We can provide medical care, we can provide world-class psychiatric care, we can manage all kinds of complicated medical conditions, but we can't provide housing. And evidence has shown us that without housing we can only get so far. So that's really the strength of the partnership between Harborview and Plymouth. Housing first is actually quite a simple idea. Without housing, people don't do very well. We give them housing first. We give them a safe place to be, and then we bring whatever services they need wherever they are. It's really about meeting people where they are. Harborview is going to be able to provide on-site medical care. We've actually worked together with Plymouth to physically design the building, which has been really exciting for us. We're going to have a room that's set up like an exam room right where the patients live.
I was born in Seattle, Washington. At 33 years old, I naive, made some wrong choices. I was homeless for almost 10 years. I had a stroke. I didn't even know I had a stroke when I was homeless. On July 28th, 2006, I moved into Plymouth Housing, and God knows, I don't think I'd be here if I didn't have Plymouth Housing, or housing, period.
Sunshine, it's Anita. Are you in? Is it okay? Hi.
Hi, Anita.
Oh, dear. When did this happen?
This is a senior disabled building, and we're not no spring chickens. And we got a lot of health problems, Sometimes we can't make it to the doctor real fast. We can just go right upstairs. It's very convenient.
Housing is the first step, and then building a relationship with the healthcare providers here and the healthcare team is the next step to get them to see that specialist and make sure that they're successful in using other parts of the healthcare system that they previously have avoided. You take a breath right here. I think just a really beautiful way to build relationships with people, especially in this place, these expectations of meeting people where they are and reducing these barriers, people that need healthcare, people that need a consistent, supportive person in their lives.
My health has gotten a little worse. I thank God that I have a stable place to take care of me, because if I was on the streets with all this, I'd probably be dead. My health is not the best, but I'm still here. Sun's shining.
Get someone into housing, get those basic needs stabilized. They know where they're going to eat, where they're going to sleep. They know that they're going to be safe. You can start thinking about the higher level needs of like, okay, let's
Where can I go to the dentist? You know, I have a bed with an alarm clock beside it now, so I can set the alarm clock and make it to my appointment. Once you're stable, you can begin to think about unpacking all of the other pieces of your health and addressing them. Just being able to socialize and be a human being who feels safe and knows where their meals are going to come from. And you can build better relationships when you have those basic needs taken care of. You might fall in love with somebody. You might make a new friend. Put a roof over somebody's head and help them take care of their basic needs. Their higher level needs can then be addressed and seen to.
I love this building. I love Plymouth Housing. I thank them. I thank nurses. It's great, super great.
If I had a home, my God, it'd mean everything to me. A roof over my head, place to keep my medicine, my insulin in the fridge, and my medicine in the cupboards, just my own place, be able to cook, you know, on a diet. I'm on 2 different diets, and get healthy again. It would give me a chance to become healthy. You can become homeless in 3 months without a check or anything and be in the same predicament I am. But if you want it bad enough, you can get it. And to me, hopefully everything's going good and I'll have a place.